Hello, everyone. Thank you for joining us squarely in the lunchtime slot. It will be worth it as we dive into my favourite investment sector, healthcare. Healthcare is pretty tricky to invest in, as it has many sectors with quite different investment dynamics. But if there's one thing that we can bank on, it's that the demand for healthcare is rising as the population ages. And the speed with which the healthcare sector innovates was shown with the vaccines that were produced at breakneck speed for COVID-19. There are indeed people who believe that interacting technologies are nearing the point at which they can transform healthcare processes and outcomes. This is largely thanks to scientists' improved understanding of molecular biology, devices collecting a lot more data, and computing and AI becoming much more powerful. In the shorter term, however, the NHS is struggling with rising patient numbers and not enough doctors to treat them. More than 6 million people were on the waiting list for pre-planned NHS treatments in England in December 2021, equivalent to over a tenth of the population. Healthcare workers, meanwhile, are overworked and exhausted. A study by the British Medical Association last year found that over a fifth of doctors were considering leaving the NHS for another career. Anyway, I'm delighted to welcome Malcolm Lowe-Laurie, Head of Health and Life Sciences Consulting at Grant Thornton, to help us navigate the challenges and opportunities for investors in healthcare. Malcolm has previously held management positions at the NHS, KPMG, Cambridge University Health Partners, and is a fellow at Cambridge Judge Business School. A quick reminder, please, to send in questions that you have as we go throughout the session. Malcolm, thank you for joining me. How are you?
I'm very well, especially after the cricket yesterday.
Healthcare spans a lot. You've got biotech and drug discovery, pharmaceuticals, health tech, health devices and diagnostics, all have quite different drivers. What do you think are the most exciting or important innovations in healthcare?
Okay, well, they all have data in common, getting hold of data and doing interesting sums on it. In fact, generally speaking, with devices, for example, if it's not a device which comes with a lot of data and ability to manipulate it, it's probably not quite as valuable as it might otherwise be. Standalone isn't enough. Everything needs to come with data and the ability to manipulate those data. But if you look at what's around and emerging well, then on the diagnostic side, there are some interesting protein biomarker companies emerging that are doing good things, for example, in prediction of different stages of heart disease or cancer, particularly emerging in the US. By the way, if I make observations on particular companies, I'm not making recommendations, just for the avoidance of doubt. So I'm not in a position to do that. But there are some fantastic companies that will allow health service providers to risk stratify their patient populations and therefore intervene in different ways rather than the one-size-fits-all way that we do at the moment. A lot of cancer early diagnostic stuff coming through and cancer therapy, exciting cancer therapy stuff. For example, in the CAR T therapies, particularly being trialed for use in non-solid tumors, leukemias. A lot of exciting stuff on data connectivity so that you can do so much in terms of information gathering via the mobile phone, which is then connected into your health service provider or advisor. But you've got to pick your way through a lot of false dawns and red herrings in that market. And then finally, robotics. So we're just entering a generation with robotics where we're kind of we're just emerging from what you might call the mainframe era if you compare it with computing. So the current robot in health is typically something which takes up a whole room, but we're now about to move to the mini generation, which you can pick up and take from one place to another. So although it'll be incremental in terms of how it improves surgery, in terms of the advice I'm given, it will allow a lot more flexibility in how that service is delivered, because you can recreate operating theatres very quickly, and you can use that as a vehicle for concentrating high-tech surgery in fewer centres ultimately, which would help rationalisation of health service costs, which, as you know, are a bit of an issue at the moment. So some things to think about there.
Yeah, that's brilliant. Thank you. Well, we'll come back to all these different innovations and how they're interacting later. But from an investment point of view, I think the big thing that everybody's worried about at the moment is inflation. Um, which healthcare stocks do you think are likely to hold up best in an inflationary environment with a worsening economic outlook? Because there are some areas with pretty defensive characteristics.
Yeah, um, of course. I mean, you'd be just as well off going to somewhere like Forbes for a look, or Goldman Sachs, as somebody like me. But if you think of what's holding up, I mean, the in terms of big pharma, you can differentiate between those that have got strong pipelines in key areas and those that haven't. Particularly if it's in areas that are going to be perennials in terms of a disease, and therefore requirements to meet those diseases. So people who've got strong pipelines in cancer, for example, are always worth a bet, because if you think of a pandemic, that's given us an immediate kind of infection resolution issue, and a flurry of activity, some of it absolutely brilliant around that. But always pottering through will be issues like cancer and heart disease, which are the kind of perennials, if you like, which are very complex, turn out to be many diseases, according to the advice I'm given. And therefore, we're always going to have needs there. So they're always going to be sustainable in terms of value if they're good products to address those disease needs. So I'd look at those. Clearly, there are the Thermo Fishers of this world that have done very well selling through COVID, and so are likely to be well placed for the next pandemic or series of pandemics. And people in this conversation probably know that the pandemic we're just emerging from is unlikely to be the last. If you look at the evidence from Asia, I mean, they have localized or regional pandemics much more frequently than we have across the rest of the world. This happens to be one that's kind of spilled over to the rest of the world. So companies like that are very much worth thinking about. But don't forget, as well as people on the industry side, think about things like insurers and providers of healthcare services. Some of those are going to do better than others. So if you're interested in the American market, have a look at companies that offer more imaginative products and deals in order to sustain subscription and keep a bigger membership into the market. Because as it gets tough for that insurance, for that payer environment, there's going to be one of those interesting exam questions about how you do well in a declining market. And that's where you might like to place a bet, and that's where you're likely to get a bit more inflation proofing.
Great, thank you. You talked about cancers and the development of therapies earlier, and a lot of those are in biotech companies, which have already had a huge sell-off. We talk about a declining market, but they've already, lots of them have fallen a lot, and people think they're very attractively priced now. Where, for investors looking at biotech, where do you think the value is?
Well,
and how can investors navigate that?
Yeah, it's probably better to think rather than individual opinion. It's always quite worthwhile tracking what others do in this market. Who's identifying and picking up companies methodologically? How are they doing that? So is it good due diligence? So look at if you like, the buyers in different parts of the market. So there's a firm like Parkwalk that's very good as an investment proposition, understanding where to go in terms of likely successes. So keep your eyes on how people operate that. Also look at ecosystems. And what's interesting is not just investment, but investment existing in a broader scientific and health community like Cambridge or Oxford or Manchester, and before you go across the pond to Boston or the Bay Area. Because interesting, the companies that emerge, that are spun out by the research side in those ecosystems tend to get picked up by investors who have strong understanding. So it's quite interesting, isn't it? You for that you probably turn less to the bigger corporate investment houses and think more about big but highly knowledgeable angel groups in order to guide you. What are they buying? What are they targeting? And what kind of methodology, what kind of due diligence are they using to do that targeting? And that will give you a sense, I think, of what's likely to be more assured, as opposed to having to place a bet yourself, which clearly is by yourself, which is clearly commensurately more risky.
What's the funding environment like generally for these companies currently?
It depends where you are. So if you go to Cambridge, for example, typically a Series A investment will be double-digit millions, sometimes 30 to 40 million, and building up from there. So by the time you get to Series B and C, you're into hundreds of millions these days. So, and again, of course, London and the rest of the Golden Triangle will be similarly useful. And you'll find developers and people around the science and investment ecosystem in health tend to concentrate their efforts based on what they think are good environments, as opposed to what they think are good individualized product sources. So it is worth, you can see why there are 450 plus life sciences companies around Cambridge, and then an investment community around that, because people know that's likely to generate quite a lot of success. Doesn't mean there won't be the odd zombie company. There will be those, but one of the challenges is what intelligence can you derive from that local environment in order to guide you through what's likely to be a zombie and what's not. Take sticking with Cambridge, for example, you've got investors like Cambridge Innovation Capital, an interesting mixture of the university, of angel groups, and other corporate groups, which seems to be pretty good at spotting who's going to do well and who isn't. So what are those kind of 500 million to $1 billion type funds doing, which tend to be more locally sensitive? How can they guide us in what's going to come through or not?
And how politically sensitive is healthcare in the UK? Because in America is notoriously so, and I just wondered how politically sensitive you find UK healthcare companies.
It's super sensitive. So the NHS itself, it's one of the challenges is because it's so sensitive, being able to sell into it is very difficult, and being able to partner with it is very difficult. And of course, the other side to that coin is that politics gets into health quite substantially, and therefore drives a lot of the process. And to a certain extent, that can drive out innovation. But a last thought to leave people with is, despite that, there's some fantastic, innovatory, highly impactful stuff going on below tree level, which, despite political interference or apparent non-performance, seems to go well. So King's College Hospital, according to all the obvious indicators, seems to be struggling at the moment, but that's one of the drivers of innovation in CAR T therapy, for example, which we should all be watching.
And I mentioned interacting technologies at the start, and you mentioned lots of exciting innovations. So Eric Topol wrote a review in 2019 about how these things were coming together. How excited are you about how data and AI are marrying our understanding of biology, and that this is going to make real differences to healthcare outcomes, because there are lots of challenges as well?
Yeah, it's technically exciting, but we've got to remember there are a whole bunch of other things in terms of environment, wider determinants of health, and all the rest of that, which impact on people's ability to consume health effectively. So there are two sides to this. One is how you can focus on those groups, and in a sense, the other is how you can work differently with wider sets of groups that can use this intelligence to look after themselves progressively. And self-care, of course, is one of the big things with big benefits we need to get out of innovation at the moment in health.
Great, thank you. And this is just a bit off topic and we're running out of time, but one more question. How do you feel generally about the NHS and how it's coping with the healthcare strain at the moment?
Well, I mean, the bad news is it's under obvious strain. I mean, the slightly good news is that no developed health system seems to be any different. And I was reviewing Australian and Canadian health plans yesterday. they say exactly the same thing about recovery, about trying to move care out of hospital, about workforce challenges. Probably the biggest challenge in developed world health services is getting workforce, even in places like Australia, which have hitherto been thought of as a sort of paradise for health workers who want to escape the rigors of Northern Europe. So there's a lot of commonality, and I think it's going to have to be a challenging but managed process to get us out of this in the next 5 to 10 years, because no doubt recovery periods will be long.
Great. Well, thank you, Malcolm. That was fascinating. Really appreciate your time. And thank you, everyone, for listening. Please stay with us for our next session, which will be on investment trust megatrends. And I'm afraid you'll be stuck with me again. Thank you.